Imagine waking up on Black Friday, grabbing your phone and opening your inbox. And right there, sandwiched between, I don't know, a promo for 50% off a new TV and a targeted ad for some sneakers, there is a ticking countdown timer.
A literal bright red countdown timer.
Right. And it's offered you 70% off your first month of a heavy-duty prescription-only weight loss injection.
Complete with like a flashy checkout code. I mean, it feels entirely dystopian, but that is not a hypothetical scenario. That's a real email sent to actual consumers.
It is wild. Welcome to the Deep Dive. We are unpacking a super fascinating and honestly sometimes alarming intersection today.
We definitely are.
I was recently looking through some materials from the 32nd Annual AICC RCOG Medical Conference. And in the souvenir book, they included this snippet of an old poem by Edgar Albert Guest. It's called It Couldn't Be Done.
Oh, I know that one.
Yeah, the lines go, "Somebody said that it couldn't be done. But he, with a chuckle, replied that maybe it couldn't, but he would be one who wouldn't say so till he'd tried."
That really captures the spirit of medical innovation, doesn't it?
Exactly. Medical science embodies that spirit every single day. Researchers are constantly conquering the impossible. But the complication we're exploring today is, well, what happens when those impossible medical breakthroughs leave the highly regulated, sterile laboratory and become these aggressive consumer products in your social media feed?
Yeah, it gets messy because we're looking at a landscape where the boundaries of private medicine are just evolving incredibly fast.
Faster than the rules can keep up with.
Exactly. So to give you a sense of where we are heading, we'll start by looking at some cutting-edge intimate health science, specifically cellular regeneration treatments, things like PRP and energy-based devices.
The stuff that sounds like literal science fiction.
Right. And from there, we'll examine what it actually takes to access these complex procedures in private London clinics. Because over there, strict medical ethics often collide pretty hard with consumer demands.
Oh, the bureaucracy's a whole thing.
It really is. And finally, we'll unpack the UK's regulatory crackdown on the absolute free-for-all of pharmaceutical advertising happening online right now.
So let's start with the science, because the frontier intimate health is seeing shifts that genuinely alter people's lives.
Absolutely.
The specific condition highlighted in the conference materials and in some recent studies is postmenopausal vulvovaginal atrophy, or VVA.
Right. And to really understand the innovations here, we kind of have to understand the mechanics of the condition itself.
So what's actually happening in the body?
Well, when a person enters menopause, the body experiences this massive drop in estrogen. And estrogen acts as the primary biological fuel that keeps vaginal tissue thick, highly vascularized, and elastic.
It's the maintenance hormone, basically.
Exactly. So under these hypoestrogenic conditions, when that fuel source diminishes, the tissue lining thins out considerably. The body stops producing as much natural moisture, and the structural integrity of the area just fundamentally changes.
And the real-world impact of that tissue change is severe. It carries a huge psychological burden because it's rarely talked about openly.
It really isn't, which is a shame because it's so common.
It leads to persistent burning, itching, severe dryness, and it also causes dyspareunia, which makes intercourse incredibly painful.
Yeah, the quality of life impact is huge.
And for decades, the standard medical fix has basically been low-dose topical estrogen creams. You just apply the hormone directly to the area to try and, wake the tissue back up and manage the symptoms.
Which can be effective, to be fair, but they require consistent, ongoing application, and frankly, they just don't work for everyone.
Right.
That brings us to the shift in how specialists are approaching the tissue now. Instead of just supplementing the body with outside hormones, the goal now is to force the body to structurally regenerate itself.
This is where it gets fascinating, because a 2025 study published in Frontiers in Medicine really caught my eye regarding this shift.
Oh, the PRP study.
Yes. They took 66 patients and compared the standard daily estrogen cream against platelet-rich plasma, or PRP, injections.
That is a great comparison to look at.
So half the patients got the regular estrogen cream, while the other half, who had actually tried and failed to get relief from estrogen previously, which is a key detail, were given the PRP injections straight into the vaginal walls.
And the mechanism of PRP is just a fascinating use of the body's own resources. So they draw your venous blood just like a standard blood test at the doctor.
Right.
And they place it in a centrifuge. The centrifuge spins the blood at these super high speeds, which basically separates the components by density.
Like separating oil and water.
Exactly. The heavy red blood cells sink to the bottom, allowing the clinician to extract the plasma sitting at the top, and that plasma is densely packed with platelets.
And those platelets are the entire key to the treatment, right? Because they aren't just there to clot cuts.
No, not at all.
They contain these powerful signaling molecules,
Hmm.
specifically things like platelet-derived growth factor or PDGF.
Which are crucial for healing.
Yeah. So when the clinician injects that highly concentrated serum directly into the thinned vaginal walls, those growth factors act like foremen on a construction site.
That's a great way to put it.
They trigger this aggressive healing cascade in that localized area.
They stimulate cell proliferation, right, prompting the body to synthesize fresh type 3 collagen to restore elasticity, and they also promote angiogenesis.
Angiogenesis, that's the creation of new blood vessels, right?
Exactly. It's the biological creation of entirely new blood vessels to restore blood flow and natural moisture to the tissue.
So the tissue is essentially being tricked into thinking it has sustained an injury. And that forces the body to rush all of its dormant regenerative resources to an area that was previously just, atrophying.
And the results from that frontier study demonstrate just how effective that biological deception can be.
Yeah, the numbers were striking. By the 12th week of the study, they had the patients complete these really detailed questionnaires.
The FSFI and VSQ scores, right?
Yep, measuring both sexual function and symptom severity. And the patients who got the PRP injections reported significantly higher scores in arousal and lubrication. Plus, they saw dramatic reductions in pain and burning, but especially compared to the group just using the estrogen cream.
It's a massive improvement.
But knowing the results are that strong, I naturally started looking into what it actually takes for a patient to undergo this.
Yeah.
Because it's often marketed to consumers under the trademark name, the O shot.
Right, the O shot.
So I read through the actual clinical preparation instructions from a sports and musculoskeletal medicine practice. And honestly, it is a surprisingly intense undertaking.
Oh, the prep is no joke.
Not at all. Patients are required to drink half their body weight in ounces of water the day of the draw. They need to eat a strict zero-fat diet for 12 hours prior.
Wow.
Fast completely for 4 hours before the appointment. And they have to stop taking any NSAIDs, like Advil or Alev, for a full week beforehand.
Yeah, the rationale behind that prep becomes pretty clear when you consider the mechanics of blood plasma.
Oh.
Well, if you consume a high-fat meal before a blood draw, your blood plasma becomes lipemic. It actually gets cloudy and thick with fat molecules.
Oh, gross.
Yeah, it's not ideal. Imagine trying to filter a really thick broth instead of clear water. It makes isolating those crucial platelets significantly more difficult and a lot less effective.
Okay, that makes sense. And the restriction on basic painkillers like Advil, I'm assuming that comes down to how PRP actually works.
Exactly. NSAIDs are anti-inflammatory drugs. But PRP relies entirely on creating an inflammatory cascade to trigger the body's healing response.
Right, because inflammation is literally the first step of regeneration.
Precisely. If you take an anti-inflammatory, you are chemically suppressing the exact cellular workers you just paid all this money to activate.
Right. But still, when you compare all of that hidden lifestyle hassle, the fasting, the heavy hydration, the painkiller bans, to simply applying an estrogen cream before bed, you really have to wonder if the friction of the procedure is actually worth it for the average person.
Well, for someone who responds perfectly well to a simple cream, the friction might not be worth it.
Sure.
But for patients where estrogen is medically contraindicated, like, say, breast cancer survivors whose tumors were hormone receptor positive, or for those who simply don't respond to topical treatments anymore, a temporary fasting and hydration hassle is a relatively minor inconvenience.
That's a really fair point. It's a trade-off for genuine cellular regeneration.
Exactly.
But needles and blood draws aren't the only options on this frontier either. Energy-based devices are taking up a huge portion of the clinical space.
They really are.
I was looking at some procedural notes from a plastic surgery center, and specialists basically break these treatments down into two main categories: lasers and radiofrequency.
Right. And while both aim for the exact same end goal, which is collagen remodeling, they operate on entirely different physical principles.
So the ablative lasers, like the Mona Lisa Touch or Diva, they're essentially aerating the tissue, kind of like you would aerate a lawn.
That's a good visual.
The device punches these microscopic holes into the surface of the tissue. And that microtrauma forces the surrounding healthy tissue to bridge the gap and grow back thicker and firmer.
But because it involves physically breaking the surface, the protocol usually requires about 3 separate healing sessions spaced several weeks apart.
Right. Whereas the radiofrequency devices, like Genevieve's or Thermiva, they utilize deep, penetrating heat rather than surface ablation.
Yeah, it's a totally different approach.
To stick with the lawn analogy, if lasers are aerating the lawn from the top down, which sounds incredibly convenient on paper. Though, I mean, it does make you wonder how long those non-ablative results actually last compared to the more invasive laser procedures.
It's definitely a debate in the medical community.
But regardless of which technology a patient chooses, these are highly complex, physically demanding treatments. You can totally see why a doctor would need to carefully evaluate a person's medical history before just, administering them.
Right, and that complexity really explains why when you actually try to book one of these procedures, you encounter this massive wall of medical bureaucracy.
Oh, the bureaucracy is intense.
It is. Accessing these treatments usually requires stepping outside the standard public healthcare system and entering the world of private clinics. And it is a completely different ecosystem. There's a steep learning curve regarding how the administrative side operates.
Yeah, I pulled up the frequently asked questions page from the London Skin and Hair Clinic, and it paints a very clear picture of this dynamic.
What'd they say?
Well, on one hand, the accessibility is a massive draw for patients. You don't necessarily need a GP referral to book an appointment with a private specialist, which is great because it allows people to bypass notoriously long waiting lists.
True. But the financial logistics, however, are incredibly rigid.
Oh, completely.
If a patient plans to use private health insurance, the clinic's policy is uncompromising. The patient must have a valid authorization code from their insurer before they even walk into the building.
Right. Insurers require that to prevent fraud and ensure it's medically necessary.
Exactly. And if a patient shows up without that pre-authorization, the clinic will not bill the insurer directly. The patient is paying entirely out of pocket that day, and the burden of submitting the invoice and fighting for reimbursement falls entirely on them.
That sounds incredibly stressful. And even if a patient is paying strictly out of pocket, the clinics still enforce what they call a duty of care.
Which is a huge speed bump for a lot of people.
Right, because there is this significant psychological shift that happens when a patient hands over a credit card for, like, a 285-pound initial consultation.
They feel entitled to a product.
Exactly. They expect the private clinic to operate like a high-end retail store. They have the money, they want the laser treatment, so they instinctively expect drive-through service. They want it that same afternoon.
But the FAQs explicitly state that procedures are rarely, if ever, performed on the same day as the initial consultation.
Right. And it feels like there's a real tension here between consumer convenience and medical ethics.
There absolutely is. In the private sector, the patient is effectively acting as a consumer. But the clinic is still bound by strict medical ethics. They mandate a cooling-off period.
Which makes sense.
They need time to ensure the patient is a suitable physiological candidate, that they fully comprehend the risks involved, and, crucially, to prevent vulnerable people from making impulse decisions regarding irreversible medical procedures.
And you see that exact same friction with repeat prescriptions, too.
Oh, definitely.
A patient cannot simply get an infinite refill on a medication just because they're paying a premium out of pocket. The clinics mandate follow-up consultations at least every 12 months to monitor the treatment's efficacy and check for side effects.
And for some specialist medications, they require entirely fresh blood tests before a refill is authorized. You can't just click reorder like you would on Amazon.
Right. It must be so frustrating for patients who just want a quick fix.
Yeah.
But it is rooted entirely in patient safety.
Exactly. The human body changes, and long-term use of any prescription alters your biological baselines.
Yeah.
But the frustration from the patient's perspective is palpable. The consumer mindset, desiring speed, convenience, a seamless transaction, it clashes violently with the reality of responsible medical care.
So the clinic has to act like a cautious, slow-moving medical provider despite the patient paying for speed. But that friction serves a purpose. It prevents the medical field from devolving into pure, unchecked commerce.
Which brings us to the inevitable question: what happens when that friction is completely removed?
Oh boy. You end up with a severe compliance nightmare.
You really do. What happens when clinics, online pharmacies, and social media influencers cross the ethical line and start marketing heavy-duty prescription drugs as if they are fast fashion items?
In the UK, the Medicines and Healthcare Products Regulatory Agency, the MHRA, is currently fighting a massive battle against this exact phenomenon.
They have their hands full, that's for sure.
I read through a 2025 presentation from the MHRA's head of advertising, And they are aggressively enforcing Regulation 7 of the Human Medicines Regulations.
And Regulation 7 is basically the golden rule of healthcare advertising in the UK.
Yep, you cannot promote prescription-only medicines or POMs directly to the general public, period.
Yet, if you're scrolling through social media platforms, you see the aggressive, fast-paced marketing tactics usually reserved for consumer tech being applied to serious pharmaceuticals.
It's everywhere.
The psychology of fast fashion advertising, things like scarcity, urgency, social proof, it's incredibly effective at bypassing a consumer's rational skepticism.
And the focal point of these violations right now is the skinny pen craze.
Oh, yeah.
These are the injectable GLP-1 weight loss drugs, things like Wegovy, Mounjaro, and Saxenda. The MHRA is also battling illegal ads for aesthetic Botox and severe hay fever steroid injections.
The tactics used in these ads are genuinely shocking.
They really are. We discussed that Black Friday email earlier, offering 70% off Mounjaro with a flash sale countdown timer.
A literal timer pressuring a consumer to make a snap, impulse decision on a drug that fundamentally alters their gastrointestinal hormones.
It's insane.
It is designed to bypass clinical assessment entirely.
And the MHRA also flagged influencer accounts sharing their personal weight loss journeys, complete with, balloon emojis, while offering discount codes like NAME25 for 25% off Mounjaro.
Which is blatantly illegal.
And some advertisements try to bypass the specific drug names by just calling them skinny pens. Others boast that free anti-sickness tablets are included.
Right, as if it's a free gift with purchase at a cosmetics counter.
Exactly. Rather than an admission that the drug causes profound nausea. It's wild that in a world where you can get targeted Instagram ads pushing a Black Friday deal on a medical injection, these are actually heavy-duty prescription drugs. It completely blurs the line between a careful healthcare decision and buying a pair of sneakers.
And the specific type of advertising undermines the role of the medical professional. The decision to initiate a drug like Wegovy requires a thorough clinical assessment of a patient's BMI, their comprehensive medical history, specific risk factors.
That's a whole process.
Right. That decision should never be contingent on whether a lifestyle influencer provided a 25% off code. Trusting an influencer often leads consumers to just bypass their own medical skepticism.
So how do legitimate clinics navigate this? Like if a clinic offers comprehensive weight management services, how do they legally inform the public without breaking Regulation 7?
The regulatory guidelines dictate that the focus must remain entirely on the service provided, not the pharmaceutical product.
Okay, so service, not drug.
Exactly. A clinic can advertise a weight management consultation. They can provide balanced, factual information about obesity as a medical condition, but a casual browser should never see a specific prescription drug name in an advertisement.
They also cannot use customer testimonials that praise a specific medication, right?
Correct. The MHRA even cracks down on sneaky digital tactics, like hiding the drug name in the hover text of an image, or embedding it in the website's URL structure to drive search traffic.
Wow, they are really policing the metadata.
They have to. Blurring the line between a careful healthcare decision and a consumer impulse purchase is incredibly dangerous, which is why the MHRA utilizes statutory powers to stop it.
So what are the actual consequences?
Well, they generally attempt to resolve noncompliance voluntarily first by just asking the company to amend their marketing.
A polite warning.
Right. But if a company ignores them, the MHRA escalates the situation by issuing a minded to notice.
Which is formal legal phrasing for, we are minded to take legal action against you.
Exactly. It initiates a legal due process. It gives the advertiser 21 days to respond, prove why their advertisement isn't breaking the law, or just pull the campaign down entirely.
And if they ignore that statutory notice,
The penalties are severe.
the maximum penalties involve unlimited fines or up to 2 years imprisonment or both.
2 years in prison.
2 years in prison for a Black Friday email campaign. It shows exactly how high the stakes are when consumer marketing tactics are applied to prescription medicine.
It really highlights the central tension we've been tracking today. As medical science becomes more advanced, more personalized, and increasingly funded out of our own pockets, the line between being a patient and being a consumer is going to keep blurring faster than ever.
We have covered a massive amount of ground exploring that blurred line today. We started by looking at the microscopic science of how your own blood platelets and deep penetrating radiofrequency energy are being used to regenerate vaginal tissue and treat conditions like VVA.
Amazing science.
Truly. Then we unpack the necessary bureaucracy of private London clinics, where patients have to navigate authorization codes and mandatory cooling-off periods that are basically designed to protect them from their own consumer impulses.
Right.
And finally, we looked at the MHRA's regulatory crackdown on influencers and online pharmacies treating prescription weight loss injections like discount shoes.
We've spent a lot of time analyzing the immediate dangers of medical advertising to consumers, but looking at the broader implications of private out-of-pocket medicine raises a really critical question about the future of medical equity.
It really does. As these highly targeted out-of-pocket treatments become more normalized, what happens to the standard of public health care?
That's the big question.
If everyone who can afford it simply buys their way to cellular regeneration and tailored weight loss, do the traditional, widely accessible treatments get left behind in the dark ages? We really have to ask ourselves if we are moving toward a reality where the impossible only becomes possible for those who have a discount code.
It is a vital question regarding whether medical breakthroughs will ultimately serve public health or just private consumers.
Thank you so much for joining us on this deep dive. Keep questioning the information you consume, especially the targeted ads in your social media feed. And remember the poem we started with. Medical science will always keep tackling the things that couldn't be done. But just because a breakthrough exists doesn't mean it should be sold to you on an impulse. Catch you next time.